Hello my loves, welcome back to my channel. Today's video is gonna be a super fun one guys, and I know that I say this all the time, but I swear today's one is gonna be a fun one, okay? On a real note though, with the sudden surge of skincare and a lot of information coming into the internet, there is a lot of good information, there's a lot of bad information, and there's just upright dangerous information that's there on the internet today. So what that does is, to the average viewer, everybody is left confused with just way too much stuff freely available on the internet. So I thought, why not get a bunch of professionals, guys? We have a board of 4 doctors here with us today to answer your burning skincare questions. Is glycolic acid bad for brown skin? Is glutathione really recommended? What about fungal acne and best sunscreens in the market? All of those questions that you've been wanting to know. And also, they're gonna be busting a couple of skincare myths. So let's get started. Now, of course, before we get into the video, let's get a brief introduction of who we are talking to. Let's start with Dr. ANURADHA JINDAL. Hello, welcome to my channel.
So, hi, I'm Dr. ANURADHA JINDAL. I'm a dermatologist. I did my MD from KMC Manipal. I'm currently working in Manipal. And I did a fellowship in aesthetics and dermatosurgery. So, yeah, my areas of interest are I like aesthetics and immunoglobulin disorders.
Awesome. Next up, we'll have Dr. Anu KP.
Hi, my name is Dr. Anu and I work in public health.
Awesome. Short and sweet. Next up, let's have Dr. Ashok.
Hi audience, myself Ashok. So I did my postgraduation from KMC Manipal, and I'm currently in Calicut working for Hairocraft Hair Transplant Center, and my special interests are on hair transplant and braces.
Awesome. And finally, we have Dr. MALCOM.
Hello everyone. Hi Jovita. Hi all the viewers out there. Okay, I'm Dr. MALCOM. I'm basically from Bangalore. I've done my MD dermatology from KMC Manipal, and further ahead I went and did fellowship from Venkat Center from Bangalore. My areas of interest are basically whole of dermatology and few of aesthetics as well.
Awesome. So first of all, thank you so much, doctors, for coming into my channel and taking this time out to answer the questions. So we had 890 questions. I asked my followers on Instagram. So I have rounded up 18 of those questions, which were the most common and I feel like the most significant out of the lot. So I'm going to pull up one by one and ask you guys the questions, okay? So the very first question is from Blush and Ochre, and the question is, what is an effective treatment to acne marks?
Acne marks is something which we quite commonly see in our day-to-day practice. Okay, it can range from a mild pigmentation, and it can go up to an atrophic scar or an hypertrophic scar. Coming to dealing with these scars, if it's going to be a pigmentation, it's a very simple job. You can just use some lightening creams, lightening agents like the terbinafolic acid, glycolic acid, or a triple combination also, like which uses a pigment regimen. When it comes to atrophic scars, there are 3 types of atrophic scars. That is, we have a rolling type, we have a box type, and we have an ice pick type. So we have different modalities to treat each and one. Supposedly, subcision is preferred in rolling scars. Then we have microneedling RF being preferred in ice pick scars. And we have the fractional carbon dioxide, dictating things in rolling and box scars again.
Okay, so the next question we have is from Nivedita Devulapalli, and her question is, can dark circles be really lightened? If so, is there any cream that can actually work?
The term which we use for dark circles is periorbital melanosis. There are quite a lot of factors which precipitate dark circles. So it can range from mild sleeplessness to some malignant conditioner, or some metabolic syndromes can also precipitate this, and even sun exposure can precipitate this. There is no point in just applying a cream to lighten the thing if you're not going to address the underlying pathology. So any one cream, if you want me to suggest, I think vitamin C is quite safe, because the skin around the periorbital area is quite thin. So we can't go for heavy regimens on those areas. It's better to stick to mild lightening agents. And also in some cases, they have deep set eyes. So in those cases, it's quite difficult, because the anatomical variation is the one which is dictating the conditions. My professor, there was a recent talk. So he was telling, a dark circle can be, viewed with some form of the makeup. We all try to blush our eyes and everything. So it is a nature's gift to us in some way, if at all, you find it tough to handle.
Oh, nice. I like that.
Can I add something to that?
Yeah.
Dark circles are multifactorial. I think it's very important to know what causes it and treat accordingly.
No, the question was, is it going to be just
Yeah.
one cream which is going to suggest, right? So I was just
What about retinoic acid?
yeah, it can be tried, but then again, retinoic acid it can cause some amount of irritation to patients, and you have to know how to use it.
Kligman's formulation.
See, Kligman formulation I won't support that in periorbital area, because
What is that?
It's basically in very old days, he kind of brought in 3 different agents together and gave out this miracle formula which can bring down the pigmentation in a very faster time. So it consisted of a steroid, and it also consisted of a retinoid, and also it consisted of hydroquinone.
Hydroquinone,
Okay?
yeah.
The long-term use of such creams can have undesirable effects, and you should always consult a professional before start using them. And again, under eye is not a safe area to use this cream. Okay, so
Kligman's regime.
So Kligman's regime or triple combination was actually introduced for melasma. So melasma is something, the pigmented lesion which occurs on the cheeks. Okay, there is difference between the skin over eyelids and the skin over cheeks. Your skin over eyelids is the thinnest skin all over the body. So that means you can't just use anything or everything on your skin.
Exactly.
Correct?
Yeah.
So retinoic acid itself causes so much of dryness and irritation. If you just start using it, within 3 days, I can tell you the patient will land up with redness and irritation over the eye. Okay, so there is a specific way of how you should start using it, how you should regulate it, and it should always be used under the effect of a moisturizer. That is very, very important. Okay, and a sunscreen. If you are using a retinoid in the night and if you are going out in the day, you will definitely have some kind of irritation and photosensitizing effect. The pigmentation over eye might look very simple from far. You might feel that it is just pigmentation, but sometimes it is not just the color. The skin over the eyelid might be thickened. So that is called as acanthosis nigricans, which might occur in patients who have thyroid disorders, or you have PCOD. Sometimes when you stretch the skin, you might find a vein which might run from this side to this side. Itself can cause your eyelids to look darker. So that means how much ever creams I am going to give you, it is not going to work. So in those cases, something called as thioglycolic acid peels might help.
But then it's not like the doors are shut for them. We have some surgical corrections and certain laser procedures which can, help them. So there is no one miracle cream I can tell for this condition.
I was just about to ask, for a layman, so is there something like one eye cream that they can buy from the market and treat any dark circle? The answer is no. It really depends on what the cause is, right? So the next question is from Angie Sam 93. Do glutathione treatments have side effects?
Yeah, I think I will take that.
Don't go for glutathione, and I'll explain why. Despite the uncontrolled use of intravenous glutathione injections for skin lightening, the evidence favoring such a practice is minimal at the best. You also need to understand there's a strong lobby of proponents of IV glutathione for skin lightening, including manufacturers, big pharma companies, many skin clinics. They've been recommending arbitrary dosage schedules despite complete lack of evidence. And there's also potentially lots of side effects associated with IV glutathione, including kidney dysfunction, thyroid dysfunction, Stephen-Johnson syndrome, which can be fatal too. Furthermore, the duration of the therapy and the long-term efficacy is yet to be established, and it's also very expensive. Coming to oral glutathione supplements, they are generally considered safe. However, the efficacy of oral glutathione is very questionable. So, yeah. In conclusion, I would say there is a lot we don't know about it, and that's the biggest problem, And it's not probably a good idea to use something you don't know all the potential side effects.
I don't think it is harmful. Okay, we don't have the right amount of data to support the claim. That's all. Okay, so it's a quite something new thing in the market, the current trend in the market. It is showing results. People are quite happy, but we don't know what are the long-term implications.
Yeah. You're talking about IV glutathione, right?
Yes.
Do you know that it's a lifelong treatment and it's very expensive and it is associated with some of
I do agree. See, so is any treatment in cosmetology is. Everything is lifelong. There is nothing which is going to give you a one shot.
Do they really think that skin lightening your skin is worth it?
When a patient walks into me and asks me, doctor, is glutathione good for me? So I tell him, see, the amount of data which we have is not sufficient. Okay, I won't tell you to go for ivoglutathione directly. But then if you have some sort of an occasion, you have a marriage function, or you want to look something special, it can be done under supervision. It can be done. It gives satisfying results, and it is gratifying to do the procedure. But then,
Yeah.
if you want me to substantiate with evidence on long-term usage, I can't do that.
So first thing is, that's right, IV glutathione is in fact banned in some countries because of the cardiac side effects and the drug reactions. Okay, so it's not at all safe for anyone to administer just for skin lightening an IV agent, which can land up with so many problems. Okay, yeah. Then we come to topical and oral glutathione. Now topical glutathione, the problem is this. Okay, first you should know what glutathione does to your skin. So glutathione is a very strong antioxidant. Antioxidant means when you like go out in the sun, or you are going to your office, so that pollution which comes and hits your skin, it generates some oxygen free radicals, which are very unstable thing in your skin. So these oxygen free radicals, they cause damage to your skin over time, and they keep on accumulating, and when you age also, these oxygen free radicals keep on accumulating. So when you take glutathione in some formulation, it goes and gives extra electrons to these things and makes them stable. So now they are basically toxins. So it is removing that toxin from your skin. Okay.
Now, if you take oral glutathione,
Go on. Sorry. Yeah, go on. I'll ask you later. Yeah. Once you finish it, yeah.
Topical glutathione, the problem with the formulation is it is not very stable. If you, it comes with combination with a lot of things. So rarely it happens that with the amount of money you pay, you will get a very good formulation which actually works. So that is why the concentration of glutathione is kept little less. In fact, I would prefer to give oral glutathione instead of giving topical or IV. Oral also under supervision. Now that also for a limited duration in some patients, for example, that helps in lightening the skin tone. Sometimes I give it for the antioxidant effect for 3 to 6 months, but not more than that.
She answered my question, yeah.
Since we did have like a doctor's perspective, I also wanted to just put in my perspective here. A couple of months ago, I had made a video about why we shouldn't encourage the use of glutathione, because for the last 2 years I think it's been so commercialized here in India, and I feel that the companies, markets, everyone is capitalizing on our insecurity, because we Indians, we have an insecurity for dark skin as it is, and this insecurity comes from 3,000 years ago. At this point, instead of banking on something like glutathione, which will fuel this insecurity to our next generation and the coming 1,000 years, I think we should stop it and stop, speaking about it, marketing it, prescribing it, so that we can finally break free of wanting fairer skin, lighter skin, all of that. Because my argument is, if it is about an antioxidant, glutathione is not the only antioxidant there, even vitamin C is a good antioxidant, green tea is a good antioxidant, like any food that is highly nutritious is a good antioxidant. We don't really have to inject ourselves with some substance that is not really completely studied. We don't know the result of it. So that is a non-medical perspective.
No, I agree with you completely. Yeah, I agree with you completely. Yeah,
No,
that's a better way of putting it. Yeah.
No, that's the sanest non-medical, ideas I would have heard, because someone telling no to something which is showing so much of efficacy should be appreciated.
To have good skin means to be comfortable with your own skin.
Well, there are the rumors that big pharma companies are actually marketing in Asian countries where they are more concerned about skin tone.
Yeah.
I don't think we actually need it. Even the Chinese, the Koreans, they're all concerned about this.
Yeah,
Philippines, yeah, exactly.
that is why there is a
Fair and lovely, fair and handsome.
Exactly.
yeah.
Exactly. Yeah.
It
And
is all media.
Never needed.
I agree completely. Yeah, that's right. Yeah.
all right, so the next question we have is from someone called KRV. The question is, hey, some suggestions of fungal acne safe sunscreens available in India.
So, okay, I would like to tell you something that, fungal acne. So, first of all, what do you mean by fungal acne? See, there is a fungus which stays on everyone's body that is called as Malassezia furfur or Pityriasis follicularum. So, it is there present in everyone, okay? But under humid conditions, sometimes, like when you sweat a lot and it is occluded, in those conditions, or if you're admitted in some hospital for some time, that fungus becomes more powerful and it starts causing lesion. Correct? So that is present more in areas like back or your chest, because these are the areas which harbor more of oil, and fungus likes this oil. Okay? So now fungal acne means whenever your oil glands, they get infected by this fungus and they show red pimple like lesions with some pus filled inside and causes a lot of itching. So fungal acne, first of all, is not common on face. Okay, I think what you're thinking is acne vulgaris. So acne vulgaris is something which is common on face, and yes, it is true that if you use the wrong type of sunscreen for your skin type, you can land up with acne. So for example, if you have oily skin or you have acne prone skin, in those cases you should not be using sunscreens which are very thick texture or which are oily, okay, and which occlude your pores. You need something which lets your skin breathe, okay. So and use a moisturizer along with it in the night, which doesn't occlude your pores in any way. So in what I'm trying to say is, any sunscreen which is silicone based and matte finish should be a good sunscreen for your skin type, and it should not aggravate your acne at all. So try to buy a sunscreen which is non-comedogenic, okay, matte finish, preferably silicone based sunscreen. It will definitely not cause acne. You don't need a brand name.
There's usually a lot of fear when it comes to seeing silicone in the ingredients. So you're saying it's fine, go for a silicone based sunscreen?
Yeah.
That's the thing, there are like, 1-2 people will come out with silicones are bad, parabens are bad, and then people in general are just scared, So you're saying that a silicone based sunscreen is safe, and that's what you recommend, in fact?
Yes.
Okay.
Yes. There is nothing harmful in that.
All right, perfect. So we'll go to the next question. It's from Sarah_Nish. And her question is how to take care of congested, dehydrated, cystic, acne-prone skin.
So, Sarah, your problems are unfortunately too many. Now you're suffering from acne. Okay, uske saath mein you have dehydrated skin also. And cystic. Cystic means when you have very severe type of acne which is causing your lesions to look really red, bumpy, and there is fluid filled inside. Correct? So it's very usual for, we feel that patients who have acne, they have oily skin, but it is not true always. Okay, yes, excess of oil production will block your pores, which will lead to excess of acne. Okay, but what people do, the mistake is they stop using the moisturizer. Now one thing you have to remember, moisture is something different and sebum is something different. Moisture is something which holds your skin together. Okay, sebum is produced from sebaceous glands or oil glands, which makes the acne. Okay, so it doesn't mean that if you have acne prone skin you should not be using moisturizer. So I'm really thankful to Sarah for the question, because most of my patients make this mistake. They always feel that I have oily skin, why should I use a moisturizer? And whenever I use a moisturizer, I land up with more acne. So why is this happening is because you're not using the correct type of moisturizer for your skin type. So like if you have oily skin, I would tell you should use a gel based moisturizer, okay, or a very thin lotion moisturizer which is not very thick, which doesn't occlude your pores again, okay, and once a day moisturizer application would be enough for your skin type.
So
Then the other thing
you recommend that in the night or in the morning if it is just once a day?
I'll just tell you the whole routine what a patient should follow. If you have acne prone skin, get up in the morning, wash your face. What you should use a gel based face wash. Takes out all the oil from your skin. Okay. In your face wash, if you have additional salicylic acid up to 1 to 2% or glycolic acid up to 2% again, it's a good combination. You should go for it. But use it only twice a day, not more than that, because if you use more than that, it will rip off your natural oil layer of your skin. Okay, again causing the damage. After you wash your face, within 2 to 3 minutes, apply sunscreen. Again, your sunscreen should be matte finish. It should not be a thick sunscreen. In the evening, come back home after your work routine, wash your face again. Within 2 minutes, again you put a moisturizer in the night. Now, when you're putting the sunscreen in the morning, make sure you repeat your sunscreen every 3 to 4 hours. Because any sunscreen, any SPF you use, it is not going to work for more than 4 hours.
Okay, that sounds perfect. Simple enough to follow also. And for more in-depth skincare routine, you can follow the rest of my videos. So the next question is from Indrani Guha 12, and her question is how to get rid of pigmentation around mouth area.
Yeah, the pigmentation around the mouth area is also called as perioral pigmentation. So the causes could be many. One of the causes is seborrheic dermatitis, or seborrheic melanosis also. That is the same thing which Dr. Anu had told already regarding the fungus over the face. So these are the seborrheic areas over here, around the nasal area, around the oral area, on the chest or the back. So this is prone to get fungus. So this fungus can cause pigmentation. Then other than that is something called lip licking dermatitis. So when you keep on moving your lips around, that also can itself cause. Then other than that is contact dermatitis. Contact dermatitis secondary to lipsticks which you use, the fragrance in it, they all also can cause. So the main treatment is, if you have seborrheic dermatitis or seborrheic melanosis, you have to use something which is antifungal. Okay, so if you have dermatitis, you have to use something which has steroids. I mean, for a short term, don't use for a long term or something. Along with that, use a moisturizer, use a sunscreen also. All these things. Coming to lasers, you can use a Q-switch laser. That works very well for it. And chemical peels also can be done. Peels which are very basic, very low, that can be done.
Is it also possible that, people with more melanin, they just have this predisposition to have just hyperpigmentation without having any condition? All of us brown people, we just have a darker area around the mouth. Is that just a thing with brown skin, or is it one of these conditions always?
Usually it's not, because pigmentation around the perioral area is not common. So it's not which is normal.
So it is one
any
of
condition can, any condition can lead to this. All these things which I listed to you can be one of the reasons due to it. And other than this is one more thing called atopic dermatitis. Okay, atopic.
Yeah.
So those individuals are also very prone to it, and it's very quite common. See, when it's on the chest, in the lungs, it causes asthma. Okay, when it's in the nose, it causes allergy. When it's on the skin, it's atopic dermatitis. So these individuals are quite common. They have pigmentation over these areas as well.
Angles of mouth.
Angles of the mouth.
Yeah.
That is the corner of the lips.
Okay. Once again, just like the under eye circle, we need to find what exactly the cause is, and probably the best thing to do is consult a dermatologist to find out what exactly your
Treat the
reason
cause.
is. Yeah, treat the cause.
Just to add on, even a minor habit like licking your lips can cause some of this dermatitis.
Really?
And can precipitate. Yeah.
Yeah.
Can I add something? Yeah.
No, you may not.
Okay. So as rightly asked by Jovita, and I have seen few females, most of, they might have naturally dark skin over this area. In some Indian females or Asian females, you might have something called as pigmentary demarcation lines. Okay. Yeah. In those cases, you will have pigmentation around this area, extending from your angle of mouth to your chin. Okay. Both the sides bilaterally symmetrical. And it usually starts around when you start getting your periods, or you achieve puberty. So and it becomes darker over age. So the problem why you should know about this is because PDL, or pigmentary demarcation line, is something which is very resistant to treatment. You might be using a n number of creams, but it will not respond. It's really resistant to treatment, and you will mostly have to go for some peel or lasers, which might help you up to 40 to 50%.
But I would suggest, there is no hope in treating PDL. Better to listen to Jovita for her camouflaging tricks.
Damn! I was about to ask, when you said it starts coming during puberty, if it will go away, after the teenage years. Like sometimes, the acne comes in during puberty and it goes away. So this doesn't go away.
No, this doesn't go away. This is going to stay with you. Yeah. And in pregnancy, it becomes even darker because your hormones are again working on it, right?
Right. Okay. All right. Let's move on to the next question. And this one is from Helen_BB. And this question is, can microneedling, PRP, etc. remove scars and pores permanently?